Put the list up.
Well, I must admit, it's been a really tough week. I'm a bit tired. I hardly got to scrub at all any cases, and I'm a bit jet-lagged because I got off the plane from India. I was able to scrub 96 of the 100 cases over a course of 5 different hospitals, and 6 cases were actually in India itself. I only have 3 interns, so it's been quite a hassle and quite a bear to round all by myself. Anyway, here's the list for this week.
Good God, Deepa, it sounds like you've been all over the bloody globe.
Well, I have.
Right, well, up there I can see you did a gastrectomy and a Bill Roth 2. Describe the Bill Roth 2.
Oh, I would be very happy to. Actually, in 1185, Bill Roth II performed a retrocolic side-to-side gastrojejunectomy, and then in 1887, Coleman created a retrocolic end-to-side gastrojejunectomy, and then in 1889, actually, I did this research myself.
Keep up. Put the list back up.
Oh, I never get to finish, Dr. McFall, you know.
Put the list up.
Anyway, I'm chief, so continuing on in 1892.
Yeah, so, you say you had 2 lap inguinal hernias this week? Huh?
Yes, they were for recurrent.
Yeah, that's, not what I'm gonna ask you. Hello? Hey, how are you? Yeah. Okay. Yeah, my question is, who introduced the lap transperitoneal closure of the internal orifice of the groin back a series of metal clips?
It was good, 1977.
You know, regarding the esophagectomy done in India, what was it done for?
Squamous cell cancer?
Do you know what incidence of squamous cell carcinoma in Honan province in China is?
It's...
Actually, according to Schwartz, it's 160 per 100,000 patient population.
Cameron, we thought you only read Cameron's.
That's true, but sometimes Schwartz can also be appropriate depending on the situation.
Hey, baby girl. In 1982, when Mason first described the gastric sleeve procedure, what size tube did they pass to isolate the esophagus?
Does it matter? It's just a tube.
Mm-hmm.
Anyways, we had an interesting case this week. So the interesting case, it was a 62-year-old female who had an atelectic change in a routine chest x-ray 2 weeks prior and is now presenting with right upper quadrant pain with questionable biliary etiology, but on workup was found to have an empyema on chest x-ray.
All right, Krista, what was specific gravity?
It was 1.2. So anyways, we took her for a
Oh,
thoracotomy.
we need to be more careful of these things. It was 1.018.
And that's exactly right.
And did you not do a Eolis or flap?
Actually, if I may interject, what was the status of the patient's peripheral vascular disease? If you go back to your H&P, you had mentioned that the patient had a history of claudication.
So I think most of that was taken care of at DMC.
All right, Krista, next week, get the records. Present it next week. All right.
So during our procedure, we proceeded to...
Right, Krista, did they do a CT scan?
Yes, they did. We did a chest...
Can you pull up the CT scan?
Yep, just 1 second.
How much contrast did they use?
We used about...
What exactly was the brand of the contrast used?
All right.
Actually, you know, claudication...
Trace the micro back.
What? Excuse me, peripheral...
How many
Who is
neutrophils were in the
validating?
micro?
The vascular status of this patient is very important. Next, claudication itself comes from a Latin word
Right.
to limp, and actually 5 to 10% of patients are truly localized aortoiliac disease, and most patients with disabling claudication, if you read Rutherford's, you'd know what that refers to, have aortoiliac disease and infrainguinal disease, and furthermore, women with diabetes are 7.6 times more likely to have claudication than those who don't have diabetes, and, you know...
And that's exactly right.
Hey, Megan, can you go back one more slide, please?
Did you mean to my title page?
Yes.
Okay.
Wow, where'd you get this picture from? Very good picture.
Actually, it's from Google.
Google made good stuff. Hey, Google, do you have your iPad on you? Can you Google this picture? I really like this picture.
Okay, here's my list.
No, but that picture is very nice.
Megan.
What was colectomy for?
Actually, this was for colon cancer.
can show us where mass is on CAT scan?
Actually, it's right here where the measurements are. Good job!
That's right, baby girl.
All right, Krista. What was indication for nerve stimulator Megan did?